Aortic valve stenosis symptoms. You can have aortic valve stenosis for a long time before you notice any symptoms. It's easy to overlook gradual signs of a weakening heart, especially at first. Symptoms of this condition include 1. Shortness of breath, especially during exercise. 2. Chest pain or tightness that gets worse when you exercise and can spread to your neck, jaw, belly, or arm. 3. Feeling dizzy or lightheaded. 4. Fainting. 5. Fatigue. 6. Heart palpitations, rapid or fluttering heartbeat. 7. Heart murmur, an extra beat between your usual heartbeats. 8. Swelling in your ankles, feet, lower legs, or ankles. Sometimes, a family member or a friend will notice a change in your behavior or energy level before you do. In children, the symptoms include 1. Getting tired easily when they're physically active. 2. Lack of appetite. 3. Gaining too little weight as they grow. 4. Breathing problems that may show up shortly after birth. Their condition may get worse as they get older. How fast does the condition progress? How quickly aortic valve stenosis progresses varies from person to person, depending on things like how healthy you are, what stage of aortic stenosis you have, and what treatment you get. It sometimes takes years. Things that can worsen it more quickly include 1. Older age. 2. Having excess weight or obesity. 3. Smoking. 4. Having high cholesterol, high blood pressure, or metabolic syndrome. Even if you don't have serious symptoms, it's important to get the right diagnosis and treatment. If you wait too long, you risk permanent damage to your heart. Aortic valve stenosis risk factors. The main risk factor for aortic valve stenosis is being over 65. Calcium buildup on the valve tends to happen over many years. Other risk factors include 1. A history of infections that can affect the heart, such as rheumatic fever or infective endocarditis. 2. Chronic kidney disease. 3. Heart problems you were born with, such as an abnormal aortic valve. 4. A history of radiation treatment to your chest. 5. Risk factors for heart disease such as high blood pressure, high cholesterol, and diabetes. 6. Autoimmune diseases such as lupus and rheumatoid arthritis, RA. 7. Certain other conditions, including Paget's disease of the bone and familial hypercholesterolemia, hereditary high cholesterol. Aortic valve stenosis complication. Some of the complications that can result from an overworked heart include 1. Chest pain caused by poor blood flow to the heart muscle. 2. Fainting because you aren't getting enough blood to your brain. 3. Heart failure, a weakened heart that doesn't pump well. 4. Arrhythmias, abnormal heart rhythms caused by irregular blood flow through the heart. 5. Blood clots. 6. Infections that affect your heart, such as endocarditis. 7. Stroke. Some of these complications can be serious or even fatal.